I want to bring in Ashley Parker, who is staff writer at The Atlantic and an MSNBC political analyst, former Republican Congressman Charlie Dent, and here with me in studio, MSNBC's Vaughn Hilliard. Okay, Vaughn, this is really interesting. I mean, the anti-abortion movement is at the heart of Trump's base. There is no doubt about that. They have supported him since he was elected again through many controversies, right, because of his SCOTUS appointments, right? Because of the impact that's had on abortion. Has he potentially, though, crossed a line here?
This is one where you're getting pretty close. And especially, we should be clear, he did obfuscate on whether he would ban abortion medication all throughout his time on the campaign trail. He said that he would not enforce the Comstock Act, which makes it illegal to mail abortion pills, medication. But this is a moment here where I think that's where you saw Mike Pence call for the resignation of RFK, because it's not just, some of these, these anti-abortion groups, but it was Republican members of the Senate that went through the confirmation process with RFK earlier this year. And RFK promised to review mifepristone and potentially have the FDA go as far as to potentially remove it. He promised to go and actually go through a review process. And so this is the exact opposite of that by approving another drug to be available on the marketplace. This is where it's not just Mike Pence, it's not just, some of these groups, but it's Republican lawmakers who suddenly find, Donald Trump, who, we should be clear, when he was a voter in Florida last year, he did vote against making the 6-week abortion ban to repeal that and in favor of a 24-week abortion ban. And so this is somebody who seems to try to find where he sits on the balance beam of all of this, but undoubtedly it continues to rankle, and this even more aggressively rankles those that have articulated that the Republican Party should stand for anti-abortion, very strict measures.
Yeah, so Ashley, let's look at exactly what got us here, because Kennedy and the FDA commissioner promised anti-abortion activists another review of the safety of mifepristone after a conservative think tank published a study that was not peer-reviewed. It was not published in a medical journal, but it claimed that mifepristone was a problem, that there were serious complications in this, again, not peer-reviewed study of 11%. But does this put pressure on both Kennedy and the head of the FDA, if they're putting this review through, to give these folks the results they want?
Well, on the one hand, it's important to explain, which is something that the FDA spokesperson has tried to explain, that the FDA is sort of legally required to approve a generic drug if it is tested to be identical to the original drug, right? And that's what just happened. But yes, Kennedy is very clearly under pressure right now from the base. And I also think it's important to note that Donald Trump, when sort of abortion became a huge political issue, frankly, that was hurting him negatively after the Supreme Court decision to overturn Roe v. Wade, he was always able to fall back on the answer, right? The court ruled, and we're leaving it to the states now. So he didn't really have to weigh in. But this now is his FDA, right? And he has taken control of his agencies in a way that past presidents haven't. He can't say it's the independent, HHS or FDA, because he has changed the terms of how he views his agencies and his departments. And so there absolutely will be pressure. And the last thing I'll say is this strikes me as something where sort of the president and his team, no one wins. You have the anti-abortion crowd, including Republican lawmakers, including his base, furious with him. And you have reproductive rights groups putting out statements and saying, look, this is how the process is supposed to work. But reproductive rights groups are never going to be allies of Donald Trump and his administration. So no one is happy here.
Well, I mean, Congressman, if you talk to folks who are in the movement, in the anti-abortion movement, they will say, look, Kennedy promised to review this whole issue of mifepristone. In their minds, they have a study that supports their side of it, even though, again, never seen in a medical journal, and they wanted it done quickly. So is saying, well, the FDA is required to do this to approve it because it's identical to mifepristone itself, going to quiet any of that from thinking somebody here has to see heads roll?
Well, look, clearly, to me, Kennedy had no choice but to approve it for all the reasons that Ashley just stated. They had to approve the generic version of mifepristone. Full stop. That said, I think that Kennedy and Trump have probably done Republicans in Congress a huge favor by allowing this approval. Could you imagine if they didn't approve the generic version? With all the problems Republicans have going into this midterm election, it's going to be a challenging cycle for them. They know. Throw abortion on top of that. This would just open up the abortion issue as a political matter, not in a way that would be helpful to Republicans, since most abortions clearly occur through the use of the drugs. So bottom line is, yeah, I'm sure the Right to Life movement is not happy. But if you're a Republican in a marginal congressional district right now, you're just breathing a sigh of relief.
So, Vaughn, here's the thing. Trump was never motivated by religion. There was a time, actually, when he supported abortion rights. As you pointed out, he was not in favor of the 6-week abortion ban. He didn't even want the 15-week that was kind of offered as an alternative. So he has said no before. And if you add in, frankly, what Charlie just said, which is maybe Republicans have dodged a bullet on this one, is there any reason for him to move?
Not really. And I think that if you look at the Republican Party, look, they welcomed Donald Trump into their party with his past positions, what they were. They welcomed Robert F. Kennedy Jr. in, not just into the party, but to be the HHS secretary overseeing the FDA. And that's why Josh Hawley and him had quite a back and forth before he was confirmed about this very issue. And actually went back to a part of it was a Zoom that RFK did a week before the 2024 election. And he articulated to voters why they should vote for the Republican Party, because they're there to defend on the economy, on immigration. He said that the one thing that Democrats have was the abortion issue, and that's all that they can run on. And so suddenly you look here heading towards the midterms, right? You have people like Donald Trump and RFK that are going to be able to try to articulate that there's some reasonability on the abortion issue, that they didn't stop abortion medication from being accessed by Americans. 2/3 of abortions that are induced in the country are through abortion medication here. And so Donald Trump's history on abortion and reproductive rights, it's a very complicated one. He celebrated the Supreme Court overturning Roe v. Wade. At the same time, of course, he could have very well had an HHS secretary who had sought, despite understanding, as Charlie and Ashley just laid out, that there is an actual governmental process to FDA approval here. But this is one where, potentially they could have had an HHS secretary, even RFK himself, who had sought to interfere with this FDA process.
So, Ashley, look, knowing the anti-abortion voter and their power, and knowing that since their victory over Roe v. Wade, they are fully aware that the number of overall abortions has not dropped. Instead, abortion drugs now account for 63% of all abortions. And so that's part of the motivation here, right? That they see that even though they felt they won this big victory, there was another way for women who had unwanted pregnancies, or women, frankly, who were miscarrying, could access this. So is this going to change the equation for both sides? I mean, is either side going to adjust its fight?
Well, again, in this moment, it sort of feels like it's no win for the Trump administration, except for the fact that, as Congressman Dent and Vaughn articulated, it does sort of, for now at least, take this off the table as a huge issue in the midterms, which in previous midterms has proven quite effective for the Democrats. But one thing I'm interested in is RFK has talked about, and you mentioned those studies that have not been peer reviewed, that may not meet scientific standards, that because of that, he and his agency are going to take another look at the original version of some of these pills. And to me, that's another pivot point that is potentially quite problematic politically for the Trump administration, because, of course, if they somehow deem these pills not safe, right, against what 25 years of science says, then Democrats have a huge politically beneficial issue to use. And if they say, you know what, it is safe, then this base that is already so upset about the generic, it has another moment to be further outraged and infuriated.
I wonder how closely congressmen, the members of this community, the anti-abortion community, are going to be watching and listening and pushing to hear from members of Congress. And here's the reason why. I've spent numerous election cycles going door to door with people like representatives of the Susan B. Anthony list, listening to how they talk to voters and watching them win over people who weren't sure that they were even going to vote, especially in off-year elections, in congressional races, in Senate races. And I wonder if they're going to be looking deeper, far deeper than Donald Trump or the FDA commissioner, and saying, okay, we've got millions of dollars. Where are we going to spend it?
Well, the Susan B. Anthony list and other Right to Life organizations jumped into bed with Donald Trump, knowing that he has been all over the place at times on the abortion issue, that he is not particularly enthusiastic about it. They're all aware of that. So this is the guy they chose. And I suspect there'll be some congressmen who are going to go out there and make statements, in opposition to what Kennedy has done, and he really had no choice but to make that decision. They're going to say that, but they're probably in very safe seats. And so they can go ahead and beat their drums and wave the red MAGA flag and Right to Life flag. But for those who are in these competitive areas, they know this issue, the abortion issue, is a loser for Republicans. They know this turns off a lot of voters, particularly women, and that they have enough pressure on themselves right now, given everything else that's going on in Washington. Hey, there are a whole bunch of reasons to fire RFK over his anti-science, anti-vax views, what he's done at the CDC, what he's done on Tylenol. But this is not the issue to take him down. He actually, as I said earlier, he did Republicans a huge favor. And I think Trump is probably appreciative, but he won't say it out loud.